Assalamu alaikum. I am Joseph, tentative member of Group 26. I am going to tell you about a medical condition rhinitis. What actually rhinitis is? It comes from two words. Rhin means nose and itis means inflammation. It is also called as coryza and hay fever, defined simply as the inflammation of nasal mucous membrane. The lower diagram shows that how rhinitis symptoms appear. Dendritic cells, when are stimulated by allergens or pollens, causing activation of T cells, which in turn release cytokines causing beta cell proliferation, release of IgE antibodies which act on mast cell producing histamines, causing dilation of capillaries, producing more mucus production, lots of itchy eyes and nose. Etiology: the causative organisms which are mostly involved are virus, maybe rhinovirus or adenovirus. Secondary infection may also caused by the bacteria Streptococcus, Staphylococcus, or Pneumococcus. It may be spread by airborne droplets or by the direct contact with infected person. The incubation period means how long it will take to start rhinitis symptoms. It is between 1 to 3 days. The diagnostic test which confirms the presence of allergen or allergic reaction is skin prick test. Antihistamines are the class of drugs used against rhinitis symptoms. These, as the name indicates, antihistamine compete with the histamines for binding with the receptor, especially H1 blocker, H1 receptors, as they are involved for rhinitis system. H2 are for gastric acid secretion, and the mechanism of H2 and H4 are unknown. Along with the antagonism effect of histamine, they may also act as anti-allergics, CNS depressant, anticholinergic, and local anesthetics. The diagram shows their H1 blocker H1 receptor blocker effect. These antihistamines are of two generations. First generation are highly lipophilic, can easily cross BBB, blood-brain barrier, and hence the side effect of sedation. They may also act on cholinergic receptor, causing dry mouth, blurred vision. These antihistamines may also affect on alpha-adrenergic, causing tachycardia, and may have the serotonergic effect of increase in appetite. The example of the drugs include diphenhydramine, meclizine, promethazine, doxylamine, hydroxyzine, clemastine, etc. Second generation drugs. They are highly hydrophilic in nature, so they can't cross BBB, so they do not have the side effect of sedation. The examples include cetirizine, phenphenadine, levocetirizine, loratadine, and the most important, azilastine. Case study: the LB patient, 57-year-old man with the history of controlled hypertension for 10 years and intermittent type of allergic rhinitis since childhood. Skin testing confirmed that he have bush tree pollen associated allergy. LB patient have the complaints of nasal itching, sneezing, stiffness, etc. He usually suffer symptoms with ocular itching most probably during spring. He also noticed that the problems become more persistent when he shifted to an older home. The LB patient has successfully self-medicated to reduce the symptoms by over-the-counter antihistamines, decongestant like diphenhydramine in the dose of 50 mg and pseudoephedrine in the dose of 60 mg, 3 times a day or twice in a day as per needed for symptoms. Although nothing seems to be helpful for treating itchy eyes, he used chronic medication as well, like hydrochlorothiazide in the dose of 25 mg every morning and amlodipine 10 mg every day. He denies every other medical problems. His blood pressure is 128 per 82 mm of Sg, which is somehow normal. He do not have the history of adverse drug reaction, do not smoke but drink alcohol. Now I have prepared soap notes regarding the case study. First, the subjective. The chief complaints includes nature is nasal itching, sneezing, stiffness. The onset of complaint means how when the complaints started to appear. He experienced since he shifted to old home. The location of site of the complaint is eyes and nose. The duration of suffering is since childhood. Aggregation factor is sensitivity to bush tree pollen. Radiation include during summer tree pollination symptoms and the severity. He do not have the acute nor chronic. He have intermittent type of allergic rhinitis. Objective: the vital signs means we have only given the blood pressure, which is 128 per 82 mm of Sg and normal. Lab test is positive, which shows that the patient have allergy. Assessment means judgment on the basis of diagnosis of other disease. Positive skin test diagnose that allergy associated with birch tree pollen. History of controlled hypertension for 10 years. Patient is taking different medications to reduce the symptoms, but no medication is responding for itchy eyes. He have the blood pressure of 128 per 82 mmHg, which is somehow normal. No history of adverse drug reaction. Do not smoke but drink alcohol. The complaints become more prominent during the tree pollination season and less during the remaining year. The plan which we have to make in order to reduce the rhinitis symptoms and to increase the use of antihistamines. Allergen avoidance by reducing exposure to hazards, mites, moles, can reduce the symptoms. Other methods of reducing antigen exposure include washing bedding at least weekly in hot water and reducing the humidity condition in home. Reduce the use of live plants in the home to reduce mold contamination. Drugs which are best used or act as initial therapy are oral antihistamines like diphenhydramine, clismastine, but they have the side effect of sedation. So we use another second generation antihistamines like estimzole, terfenadimine, but they also have the side effects of cardiovascular disorder and they inhibit the liver enzyme cytochrome P450. The nasal antihistamines like cizylastamine intranasal spray 125 mcg per spray, but it can also have the some side effects related to headache and dry mouth. Thank you.